Now, several doctors are advising against the rampant use of Remdesivir and few other drugs. Opinions are mixed over its utilization. The Health Ministry is very clear, however, that this cannot be treated as a magic bullet. The ministry's SOP stated in the past that there is no need to use Remdesivir in the initial days of infection or, for that matter, for mild or asymptomatic patients.
The COVID pandemic is making people believe in magic bullets. They think that some medicines can be popped anytime and will help them in recovery of COVID patients. But in reality, that's not true. With such cases growing, many doctors have come forward advising against medicine abuse.
Whoever has prescribed it, if you go up in the detail, it works only in the first 7 to 10 days because it's an antiviral medication. So it's going to stop the viral replication. Once the 10 days are passed, when the virus is not replicating now we are dealing with the COVID, post-COVID or the COVID sequelae or the damage done by the virus. It should not be prescribed if anyone has a liver problem, so if anyone is having a kidney problem, because it can cause damage to that also and can worsen the scenario of the patients. So you prescribe some medication to someone, they will copy-paste and start prescribing to others also. And even now the families also start taking the same medication without even consulting the doctor, which is not a right thing.
The magnitude of the crisis is such, it has forced manufacturers of such medicines to come out strongly against rampant use.
Ivermectin was a drug which has shown some benefits, especially by the Australian and the Bangladesh trial. They showed definitely it worked. Even the guidelines started prescribing it as a prophylactic to some extent, but not everyone is not to be taken this Remdesivir. They can be taken to the healthcare workers who are more prone for getting infection. But everyone starting taking Ivermectin is not a drug to be taken by everyone.
In fact, both Remdesivir and Ivermectin haven't been approved by World Health Organization and has repeatedly warned against its extensive use.
Most of the reports published point out towards the fact that these medicines have found out not to have any immediate impact on COVID patients. Doctors believe copy-pasting of prescription is something which should be stopped immediately. If one needs to buy medicines, they should only do it when their doctor tells them. The exact dosage and the time should be monitored very closely, otherwise people can land in deep trouble. This is Aishwarya Paliwal reporting from the national capital with camera person Vakar for India.